Hi, this is Dr. Goldberg at the Goldberg Clinic. It is July 17th, 2019, and I am here today with Mohammed Al-Ansi and his wife, Dr. Hanan. Right. Dr. Hanan was actually a student of mine many years ago, an excellent student, and now she's an excellent doctor of chiropractic. Where do you practice at, Doc? Where's your address?
Stone Mountain.
In Stone Mountain, Georgia. Mohammed came to see us back about a little over 6 months ago, and you were complaining about, you were afflicted with what?
With AS.
With ankylosing spondylitis. And what kind of symptoms were you having?
I was having a lot of stiffness, a lot of back pain. I was really demobilized in my movement, and I felt very bad.
And how long had you been how long had it been when you came to see us, had you been diagnosed with ankylosing spondylitis?
Since 2010 I was diagnosed, and I've been dealing with it for about 10 years.
So this was an affliction which had caused you a lot of pain and suffering for about 10 years. And I know what you went through because I had ankylosing spondylitis as a younger man also. What were the main symptoms that you had of this disabling disorder, which is considered to be a rheumatoid disorder? It's actually a variant of rheumatoid arthritis. What were the major symptoms that you had suffered with over this past 10 years?
The main thing is stiffness, a lot of stiffness in the mornings, and really the back pain that I was having in my back. I never was able to get rid of it through stretching, through a lot of different techniques that I was told to do. So I did a lot of physical therapy, and a lot of the pain wouldn't subside.
Now, Mohammed, you also saw rheumatologists, yes?
Correct.
How many different rheumatologists have you seen?
I've seen 3 different rheumatologists.
3 different rheumatologists. And am I correct in assuming they gave you drugs?
Correct.
What drugs were you on?
I was on meloxicam, Cosentex, and different variable painkillers.
Different painkillers, okay. And during this 10-year period before you came to see us, had your condition stayed the same, had it improved, or had it gotten worse?
It was stayed the same and getting worse.
Stayed the same for a while and then it got worse?
Correct.
Okay. So, Dr. Hanan, I know that as a doctor of chiropractic, you have an excellent background in chiropractic and the natural health. What was the main concern that you had? What are the main concerns that you had about Mohammed that you were talking about earlier?
Okay, so it's been about 8 years and over that he's been on medication just to kill the pain, but it wasn't really dealing with the cause of the problem. It was just numbing out the pain every day, and the medication, and it was getting higher and higher. Just to every year it was more medication, and just to get his pain to subside. But what was happening was the whole process was getting worse. His AS was getting worse. It wasn't really getting cured. So I started getting more concerned about the side effects of the medications and all the different infections or cancers or all the other side effects that may have, led to the worst. So that's what became the main problem. So I decided to make him see Dr. Goldberg, just so I knew that he would solve this problem by looking into the root of the cause of the problem rather than focus on the medication.
I think that's very well said, and it is absolutely true that the medical approach to these problems involves very toxic medications, and also involves a lot of pessimism that you're really never going to get well, that all we're going to do is just undergo what we call disease control. We're going to control your symptoms as best we can by using medications that, as Dr. Hanan said, have some really terrible side effects to them. So thank you for that comment. I think that's very well put. So now we're 6 months into this. You've been working with us diligently, and how much improvement have you had? We have a long ways to go yet, I think, but at this point, 6 months in, how much improvement have you had?
I feel day and night difference from when I walked in, and now I would say easily 65% improvement from where I was.
All right, we have a 65% improvement over a period of 6 months. Now, ankylosing spondylitis, if you look at the definition of it, is considered to be, as I mentioned, an autoimmune disorder or rheumatoid disorder, and is considered progressive, which means over time the vertebrae begin to ankylose together, there is bridging between them, and there is increasing disability and decreasing mobility. Okay. Now, in terms of your ability to move around, what has changed in terms of your mobility?
Now I can actually function a lot more better. The morning stiffness has reduced, and I am able to function at a higher level.
Okay. And Doc, tell me from your perspective as a doctor and also as Muhammad's wife, what changes you've seen?
Well, the changes are big. I can see a very big mental and physical change. Mentally, with all the mood going back and forth, the aggressiveness, everything was just aggravating to him because of the health condition he was in. And now I see a calmer person, no more complaints of the pain that he was experiencing. I've seen him going down from the floor, totally he was unable to move. There was a day that I saw him like for an hour, he couldn't move. So I had to do a lot of ice, I had to do a lot of different things, and it took an hour for him to get up from the floor.
And recently, have you seen that same thing?
And recently, nothing at all. It's just an everyday progress, and he's able to move more now.
And we were talking about what area of the body have we primarily addressed in your care? What area of your body have we primarily worked on?
It's really my digestive tract, my guts.
And Muhammad understands this with an excellent understanding of it. We have been working on making sure that his gut is burning up everything that he's eating, that his digestion has improved tremendously. He's lost some weight in the process too. And as a result of that, it's not just, we're not treating his ankylosing spondylitis, we're getting his body systems to work well, including his digestive tract, where food is transformed into energy and into new tissue. And he's been very diligent about it. He's been a great patient, and as a result of that, he's having dramatic improvements. Any other comments? Are you looking forward to more improvement yet?
Yes, I would say to anybody that feels the way I felt or feels hopeless, you definitely have to get to a point where you're fed up with everything to make real life changes, because in 6 months' time, yes, there's other effects that you benefit from, whether it's losing weight, whether it's feeling better, whether it's not using the restroom the way you used to use. But then the bottom line is, when pain goes away, you feel better, your mood changes, but you have to be diligent and very strict and have a strong will to change.
Yeah, that says that beautifully, and we call that the will to get well, which Muhammad has, and also has had the support of another excellent doctor right over there, and both as a doctor and his wife. All right, thank you both. Thank you both for helping us understand this.
Thank you for helping us.